So, good morning, everybody. Firstly, thank you for inviting me along this morning to your coffee morning. I'm really, really pleased to be here. I'm here to help and here to try and be helpful. Some of you actually on the screen, I've come across in other forums. But for those of you who don't know me, my job title is Director of Quality for Kingston and Richmond as part of the South West London Clinical Commissioning Group. So we're the organisation that helps organise health services across South West London. What that actually means is I'm a nurse, I'm a senior nurse, and I'm responsible for a lot of the things that affect things like safeguarding adults, safeguarding children, but also the quality of services that are provided for everybody within South West London. As I say, I'm a nurse. I've been in the NHS for 32 years this year. And much of that actually has been in South West London as well. I've worked in South West London for the last 15 years or so. Before working in the CCG, I used to be the Deputy Director of Nursing at Kingston Hospital. So I've been invited along to talk a little bit about the vaccine today. And I thought it might be useful just to acknowledge also in this call that some of you may have been affected by the virus in the last 12 months, either personally with family members, but almost definitely by its impact on how you live and the way that you live your lives. And I guess for me, I just want to acknowledge that it's been a tough time for everybody. It's been tough for people in general, and it's been particularly tough for those who require support and help with normal day-to-day living. So I just want to acknowledge that and thank you for the opportunity to talk to you today. It's a really time-limited session that we have this morning. I can probably stay till about 11:45 or so. But what I will say is that if we don't get through anything today, we'll come back to it, or myself and Caroline could come back to you and join another coffee morning if you're not bored already talking about coronavirus all day, every day. But I do see from the screen the amount of interest that there is in certainly what's happening now within the country around the virus and the vaccine program. It seems like a long time ago since the virus became an issue, firstly in China, then in Europe, and then across the world. We have to remember that for the vast majority of people, this is still a relatively mild illness. I know in the news at the moment, we're talking about the hospitals and the impact on people in hospitals. But for the vast majority of people, remember, this is an illness that is self-limiting, as in it gets better by itself and goes away again. Unfortunately, for a proportion of the population, the older you are, or the other illnesses and ailments that you might have a correlation with how severe the virus affects you. And so we've been working very hard within the NHS to support people over the last year through the development of a vaccine to help manage the impact of the virus itself. For me, I think there's a lot of questions there are a lot of questions that people have about the virus. How has it been developed? It normally takes a long time. This has been very fast. Have we cut any corners? I guess for me, there's three things that I would say about the safety of the virus. The first is we have several levels of authorization for vaccines. One of those, the Medicines Health Regulatory Authority, not only works within the UK, but also covers across Europe as well. In both of those layers, they've approved, based on the science and the evidence that they have, that these vaccines are safe and effective. What do I think that means for me personally? Well, for me, when I had the opportunity to have the vaccine, I said, yes, please. I think it would be a really good thing to do. I think I would advise my mum to have it. I would advise any of my family members to have it. So where I'm saying I think it is safe and effective, I'm happy to do that myself. But as Kimberly said earlier, this is a personal choice, and we're not here to make a determination about whether you should or should not have the vaccine. That is something that you need to think about, you need to take into consideration. But I would encourage you to research it thoroughly, ask the questions that you have, take your advice from trusted sources, and make your own decision about what is the right thing to do. I'm going to pause there and say that's probably the preamble that I wanted to do, and leave most of my time actually for the questions that you have thankfully shared with Kimberly in advance, but we'll try and get through as many as we can today, if that's okay.
Thanks so much, Fergus. So I've got the questions, and some people asked several questions, so I haven't fully grouped them in. So I'm going to sort of be reading through them to try and pick them out into groups for Fergus to answer, because a lot of you asked the same sorts of questions. And we might, I don't know if Caroline from the NHS also might jump in on anything as well. So I'm not sure where the information you both deal with. Caroline, do you just want to say hi quickly and introduce yourself so everyone knows?
Yeah, so hi everyone, my name's Caroline. I'm the lead engagement manager at South West London CCG for Kingston and Richmond. And my role is exactly what we're doing today. So it's making sure that the local NHS goes out, talks to people, make sure you understand what we're doing, the services we offer, and also where you can have a voice and have your say in the services that we're developing. So for today, it's very much about making sure you've got the information you need about the vaccination and hoping we can answer as many questions as we can for you. Thank you,
Caroline. Okay, so we've gone over, Fergus mentioned a couple of things around the safety and testing of the vaccines. So I think we've answered most of the questions that came through around that, that had largely come from PAs. But there are sort of a couple more around the sort of nitty gritty around that. So someone's questioned the gap between injections. So a lot of us know that people have had the first injection and that they initially said there'd be a 12-week till you got the next one. And that was, at the time, they said that was the optimum thing to do. But of course, looking at the number of cases that arose, they changed that decision to make sure that as many people got the first vaccine as possible. So how effective is it when you've just had the first dose, and what are the implications on waiting longer than the sort of initially said 12 weeks for the second dose?
So there are two vaccines that are currently in use in the UK. There is a third that has not yet been delivered for us to use. So I'm going to talk about the Pfizer vaccine. I'm going to use the names of the companies who produced it, but the Pfizer vaccine and the AstraZeneca vaccine. They were both tested in slightly different ways. So the evidence base or the data that they produce as a result of their clinical trials is not exactly the same. The AstraZeneca vaccine was produced, and it did have a testing regime within that to identify what might be the optimum time or the most useful time to have the second vaccine. And the Pfizer vaccine actually did that on week 1 and then week 3, which is what I think most people were thinking at the beginning of the program, that you would be vaccinated once and then 3 weeks later. So Pfizer are only able to offer their advice on the basis of the evidence that they conducted their trials. So they're not able to say something different to that. But the government, with their scientific advisors and the Medicines Health Regulatory Authority, have looked at both of those sets of data from the tests and trials that were conducted, and indicated that actually there is more benefit for a larger population if we use the 2 vaccine doses at a 12-week interval. I'll explain how the logic of that works in just a moment. What that means is, for both vaccines, they believe both of them have a high degree of effectiveness. Both of them, when you have had your vaccine, have about 90–95% effectiveness in preventing you from becoming ill with the virus. The logic behind having 2 doses 3 months apart as opposed to 3 weeks apart is that if you imagine a scenario where you have 2 people in a household, both are aged 90 years of age, if you give one person the first dose and the second dose, they will be covered, effective coverage up to about 90% from one vaccine, but the other person would not have had their doses because the supply is not available for us to vaccinate everybody straight away. There is a time frame between the first person and the last person getting their dose. So what the government have decided to do, the best thing to do, is to manage the sequencing of when those deliveries come, to give the largest proportion of the population a dose of the vaccine as early as possible, because that at a population level would mean that you get the greatest benefit for the population based on that distribution strategy. So part of it is driven by the availability of the vaccine, as well as the evidence that the time lag between the two does not diminish how effective it is for people.
And a couple of people, somebody wrote in, and Christine's just popped into the chat. So they're mentioning research in Israel that suggests the Pfizer vaccine isn't as effective. Do we have a comment on that for today? As it's not as effective after the 3-week period?
So my understanding is that the study that has been done hasn't necessarily been taken in complete context. So what I understood was said yesterday and reported in the media, there's some further narrative around that. So I don't think that what was reported was completely accurate. So I think that's one that's emerging in the news as we speak. Give it a day or two, and I think we'll get some more clarity around that. But I think it's often the case sometimes that a piece of information is taken sometimes out of context. My understanding is that what was said yesterday, what was reported yesterday, isn't the whole story within that one.
Thanks, Fergus. And someone's also asked, they don't have any issues with getting the vaccine, or indeed the person they care for, which is their son who has myotonic dystrophy. But they were wondering if they have a heart problem and taking medication for it, is it correct that it's not a good idea to take the Pfizer vaccine?
No, so the vaccine is very safe for the vast majority of people. I think there's some benefit for anybody before they have their vaccine, that they have a conversation which would be centered on consent. I need to understand what it is that I'm doing, and so the consenting process when you're having your vaccine should include, are you on any medications, and a check whether any of those medications might mean that there's any other signs and symptoms that we might need to watch out for as a result of that. So in general terms, it's very safe for people, irrespective of what medications there are, but there are some small groups of people where that medicine that they're taking might interact with the vaccine. So that consent process, that conversation with the person who's going to administer your vaccine, is an important one to have.
Thank you. And going on to sort of practical things. So some people have asked questions around the vaccine being administered at home. Now I know informally that some people here, and I know Monica and Mark will say that they had someone came to the house to give the vaccine for practical reasons. Someone else has said she's got her mother's 91, disabled and housebound. So is there an official line on that, or is that down to individual surgeries? What's the protocol around people visiting homes to give the vaccine?
So the Pfizer vaccine is tricky to move around from house to house or from general practice to general practice. That particular vaccine needs to be stored at a very deep freeze temperature. And when you thaw it, you then have to use it within a very short period of time. So the Pfizer vaccine is very difficult for us to take from a care home or to individual houses to vaccinate somebody. The Oxford vaccine, however, the AstraZeneca one, doesn't need to be stored in the same way. So the time frame for release of the supply of the vaccines meant that at the beginning we weren't able to do very many people in their own homes or their care homes because we had the Pfizer vaccine available. Now that the AstraZeneca version is available and we're able to move it without that deep freeze, we are able to get it out into general practices, into care homes. And we are also then, for Kingston and Richmond, we're working with Your Healthcare and Hounslow and Richmond Community Trust to help us with general practice support more and more where it's necessary, administering vaccines for people who are housebound or not able to come to the practice or not able to come to one of the vaccination centres. So we're still very early days in implementing the rollout. We're sort of week 4, week 5. As time passes, we're increasing the distribution network that we have. So bear with us. I think we will, as we get further into this, be able to do more housebound people.
Thanks. We're getting a lot of questions from people around unpaid carers. So initially, when the council asked us to collate details on PAs to register them for the vaccine, they said definitely fine for paid carers. But we had a lot of people who, the family, the network, who actually are there all the time, obviously for practical reasons, wondering where they stand, where they haven't been prioritised. Now, I know there's been changes, updates which are positive, so Fergus, it'd be great if you could share that.
So there is a committee, the shorthand is the JCVI, the Joint Vaccines Committee, who advise government about what is the right priority order for people to receive the vaccine. And what they have indicated within that is that group 6, if you like, if you look at the list, there's group 1, 2, 3, 4, 5, 6, number 1 being the most elderly, people who are living in care in residential homes, and frontline health and social care staff. As you go through the various tiers, group 6, what they've indicated within that is when paid carers would be vaccinated. For unpaid carers, if there isn't a definition within that would capture those as well. But if you are in an older age group where you have also got an underlying health condition, you'll get that in the calling order that the NHS is working through to bring people through that list. What I will say is, as we have implemented it across Kingston and Richmond, there are points in time where we get towards the end of the day, and we haven't used up all of our slots, all of our sessions that we might have, all of our bookings. So we have been flexible where we can to try and offer the vaccine to the first group first, but we will go into group 2 or group 3 or group 4 if there's an opportunity for us to avoid some vaccine wastage. I think what I would be saying is you need to work through your GP, speak to your GP if there's any problem getting you registered with your GP as a carer, whether it's paid or unpaid. It's important, I think, that if you're having any difficulties around that, have a conversation with the practice manager at your general practice to make sure that that's captured and recorded on the system. I'll pause there and just check, does that cover what you were thinking?
Yeah, so I think what you said is that unpaid carers should be classed in the same class bracket as the paid carers, but it may be about registering them appropriately with their local practice so they're aware that they're doing covering the case.
The unpaid will not be classified the same as paid at this point in time. What I am saying is if they're... Sorry, go ahead.
I think Caroline's raised her hand, so I'm not sure if she was going to NHS. Caroline wanted to say something on that point.
Yeah, I think Fergus is right that there is something under group 6 and it changed quite recently. So it is for those, I'm just reading it here now because it has changed very recently. It said group 6 also includes those in receipt of a carer's allowance or those who are the main carer of an elderly or disabled person whose welfare may be at risk. So that does cover unpaid carers, but it's a very recent change. And I think it will rely on people being on the list at their GP, registered with their GP as a carer.
Great. We've actually got Melvin here from RBK. And Melvin, I think you guys are on the case waiting to see if there are any further changes for the unpaid carers that you're aware of the situation. So that's great. How are you doing for time, Fergus? Because I know that we were only supposed to have you for the 30 minutes.
We'll keep going,
Lovely. Okay, so I think we've covered Ali's question about the vaccine being available for PAs and for people who are clinically extremely vulnerable. There might be an issue there, Ali, that we'll cover in a bit around employers' rights. I don't know if you attended the webinar yesterday. Someone has said if someone is facing surgery, there was talk at one time that they'd go up on the priority list. Is that the case?
So at the moment, pre-surgical vaccination is not something that's in place. What I would say is watch this space. Well, at the moment, the NHS is under a considerable amount of pressure. We are very keen to make sure that the most clinically urgent or the most necessary operations and procedures that people might need to have for planned procedures would continue. So for emergency procedures, if somebody has, let's say, appendicitis, they can't wait. They don't go on a waiting list. That needs to be done, and those are taken care of. There are some of them that are planned that we would make arrangements for in the matter of weeks or months. The highest categories, so P1 and P2, we are continuing to manage to deliver those those procedures. For less important surgery or less urgent surgery, there is an increasing waiting time. It's inescapable. I think it's been widely put in the press about the numbers of people who've been waiting for a long time for surgery. But at the moment, there isn't, as part of this wave of the vaccine program, a requirement that people would have their vaccine in advance of them having their surgery. What we would do is test if they had COVID. And of course, what we would also be talking about is a period of self-isolation in advance of having your surgery to protect yourself, but also to protect the staff in hospital.
And I think that you touched on earlier about local practices. So there have been a few questions that Kingston Carers reported they'd had quite a few about around guidelines. And I know somebody did say, I suppose, about should they approach their GP because they thought that their son was in the at-risk category, but they hadn't heard anything from the GP. Should they ask? And there are questions around, are GPs given clear guidelines? Someone, they named and shamed their clinic down here to say that that they were giving out, other clinics were giving out vaccines to certain groups, but theirs wasn't. So are GPs getting clear guidelines? How much movement is there? And they commented there seemed to be different advice with different GPs.
It's a really difficult one because I think but the general position that we're trying to get to within health services, including hospitals, GPs and community pharmacies, is that everybody has enough of a supply available to be able to do everybody, but we can't do that all in 1 week or in a couple of weeks. So the government is distributing the supply that we have, and that isn't even. It's not the same number that go to every general practice. Different practices will have received at different points in time the supply from government. And there's very little that we can do locally to influence that. We are trying to operate within the sequence of who should be vaccinated first. But of course, in some areas, if you've had more supply than another, you've got further into the age group. So for Kingston and Richmond, we've done really, really well with our people who are living in nursing and residential homes. And well over 80% of those now have been vaccinated. So some parts of Southwest London, we've done better, if you like, at vaccinating some cohorts of patients. And then in others, we've got a bit of catching up to do. So it won't always be that all of the horses in the race are running at the same pace, I guess is how I would describe it. I've mentioned earlier as well, we're really, the worst thing I can think of is that if you have a supply of vaccine left coming towards the end of the day or coming towards the end of your time frame when that vaccine needs to be used, that you didn't find somebody to give it to. So, and I can understand how that might be. Sometimes some practices are phoning up and saying, we have some vaccine, could you get here within the next half an hour or 45 minutes? Because I would prefer that we did that than waste that vaccine by sticking rigidly with, you must only do the over 70-year-olds, you must only do the over 75, you must only do the over 80s. I think that's a pragmatic, humane approach that practices have adopted. But it will feel different in different parts of the country, as well as even within different parts of Southwest London. The ambition is to make sure that we get the most vaccine into the most people as quickly as possible. That's what's driving our strategy, or our practice, I should say.
Thanks. And there have been some questions kind of around having had the vaccine. So people are wanting to know, is there a reinfection rate? Recorded side effects once you've had the vaccine? What precautions do you need to take, I suppose, for yourself or for infecting other people? And I suppose a little bit of clarity around what the vaccine does for you in your health, and then what that impact is on the people around you.
Okay, that's a big question. Okay, so in terms of side effects, for the vast majority of people, these are very, very minor. So where you've had your injection can get a little bit red or inflamed. That can be a little bit painful or tender for a couple of days. Some people have reported having a bit of a headache or feeling a little bit jaded. And for the vast majority of people, these side effects are very short in duration. They last for about 48 hours or so. So that was precisely how I felt myself. It was painful in my arm for the first couple of days. And I felt, instead of running at 100%, I felt more like about 80% for a couple of days, and then it passed. A very, very few people have an allergic reaction, and we have seen that within Southwest London. But it is a very, very, very small number. Out of the tens of thousands that we have done, it's 1 or 2 people. So it's for the vast majority of people, very, very mild side effects from that. But it's not dissimilar when you have your flu vaccine. You often have a bit of tenderness around the site, a bit of inflammation, a bit of a headache, and feel a bit jaded for a day or two. So broadly speaking, it's similar sort of experience of that. In terms of what it does not stop you from contracting coronavirus. So it is not a vaccine that then says you will never catch coronavirus. And it doesn't mean that if you have contracted it, that you would not transmit it to somebody else. So we have to be clear that although the vaccine program is a fantastic strategy for us to reduce the risk to everybody, it does not eliminate coronavirus, and it does not stop us from transmitting it to other people if we have it. But what the vaccine does is stop you from getting or prevent a lot of people from becoming seriously unwell with the virus. So even if you've had your vaccine, you have to stick with the guidance that the government has made very plain for quite some time now about wearing a mask when you're indoors or out and about. And that social distancing thing, I would recommend 2 meters, and your hand hygiene is absolutely critical within that. And reducing the volume of time that you spend indoors mixing with other people. Those facts will remain even when you've had the vaccine. The program is not one where we will vaccinate somebody and it means we then have to, we can eliminate all of the other strategies around reducing the viral spread. I think I've covered 2 big parts of it. There was another bit to that question though. Let me come back to me again.
Big ones. Well, we've got so another big question for us is an accessibility question. So one, for instance, parent has written in about their 24-year-old son with autism. In this case, they actually are needle phobic to an extreme level. But I suppose that opens the gap too with people about communicating who need additional support in understanding what the vaccine is and making sure that the consent is clearly given. And then for those where it's difficult to make the physical approach, is that being considered in any way? And are there any cases where that's been resolved, overcome?
So I think it's one where we have more work to do. At the moment, the way things have been set up is getting lots of people through in a relatively short period of time. And that isn't terribly accessible. It doesn't necessarily take into consideration when people are distressed or disturbed by lots of noise or lots of strangers or lots of people about. I think as we get better at the supply chain, we'll be able to do more in people's own homes. And I think, you know, that's a reasonable adjustment for somebody who you've just described to possibly have it in my own home with my family around. And that could be one of the practice nurse and one of the community nursing teams administering there. It might be that we need to say, rather than coming to one of our mass clinics, we might ask you to come at a quieter period of time, right at the beginning of the day before everybody else comes. Make more space for the time, if you see what I mean, by saying, well, actually we have, rather than people coming through in 1 or 2 minute appointments, it's this person might need to have a 10 or 15 minute appointment, but very much by themselves. So I think there's more we need to do around that, Kimberly. I think that's true for lots of different people, but if we can make it as least disruptive as possible, in some cases in their own home, I think is probably the right reasonable adjustment. For others, about how do we make sure that the general practice, for example, is quiet. Have to remember also some of our community pharmacies are now starting to be able to administer the vaccine too. So sometimes that might be another way that we might say, actually, there's a small single room that this person can come to be supported by their family or their carer or their support worker. But we might have just a dedicated room for them to come to for that 15 minute, 20 minutes. But there's a little period of observation after you've had your vaccine just to make sure that you don't have an allergic reaction.
Thank you. And I think I'll add to that, just because obviously as a charity where we support disabled people, across the board, from physical disabilities, sensory impairments to learning disabilities and mental health, that there is an issue around training in the healthcare industry about how to communicate with certain groups. So that's something we're aware of. That's a general issue in the medical profession, and something we'll be talking about later in the year, but it's a conversation that's ongoing, and I think that touches in with that as well. We've had a couple of questions in the chat, which I'll open, because I'm going between an Excel sheet and the chat function. Can you choose which vaccine you have, and is one better than the other for people with weakened immune systems?
So the government advice is that one is not better than the other, that they're both very, very good. In terms of choosing, I don't think you're going to be able to have that choice. If your GP is calling you, we're not going to be able to say, well, we have a choice of one or the other. It'll be what is available, what is supplied. But because they're both very, very good, I don't think that's a problem. I'd have been happy to have whichever was available when I was called for my appointment. I don't think there's any problem with that. I do understand. So there's a cultural issue that we need to recognize here within the Black African community. There's a high degree of suspicion about Pfizer as a company, and that goes back to some unethical practices for which the company was found liable for in the last 15 to 20 years for a product that they developed and they were testing in Africa. So there's a high degree of suspicion in the Black African community about Pfizer as a company, and I think there's a requirement for us to recognize that and to think about that then in terms of the choice to make sure that we get the access that people would want to have. So that may change in the future in terms of a choice, but I think that's recognizing this community won't take this vaccine because of the history of what happened in previous years. But if there's a way that we can make sure that the other vaccine were available, I think that's better for everybody within the population. But that's my interpretation of where we're at the moment. Currently, my position would be you're not able to choose. Your GP will call or contact you to come. You'll be given what we have within that particular general practice. They won't have a supply of both sitting in the fridge for which we dip in and out of either side. We're not in that position.
Thanks, Fergus. And I'll just say the last two big things that we got asked about. So the biggest one were the various questions around children and children getting the vaccine, when that would happen, what if they were disabled, was it safe for under 16s, what generally around that?
So the good news, if you're a beautiful young person, is that this illness doesn't have a very significant impact for the vast majority of children. And even between the age of 16 and 24, 16 and 44, the impact on that age group is very, very different from somebody who's much older, whether you're over 60, over 70, over 80. As you get older, the impact is more significant. So at the moment, the greatest focus is on the older age groups, and hence they've had the strategy of starting at the older age groups and moving downwards. There hasn't been research into vaccinating the under 16-year-olds. I would expect that will come in the same way that it has for the general flu vaccine that we have every year. But at the moment, that the recommendation is 16 plus. For some children under the age of 16 with some conditions, there is a discussion to be had, I think, between your specialist or your GP and that family about the benefits and disbenefits, because there isn't a scientific evidence. It's not that it hasn't been considered, but the trials and the testing of the vaccine on very young people has not been done, has not been evaluated to make the recommendations in regards of safety. But for some people, I do understand that it may be a judgment for the person with parental responsibility for that young person to make a judgment with your clinical colleague about, in the circumstances that my child is in, whilst there isn't the evidence to support the safety of the vaccine, the question will arise as to whether you should vaccinate them or not. But that's a very small number, and I think it's one to be done jointly with the family and their specialist.
Okay, thank you. The very, very final one is, what do you do if you think a disabled family member has been incorrectly classified? on that tier system?
So I think talk to your GP practice is the most straightforward thing. I think the practice manager is the right place to start. A lot of the GP, the surgeries themselves. I think we can help from the CCG as well. And so if you've raised a question, you're not getting a satisfactory response, we have a team of staff within the CCG to help support general practice. So we can try and help if that's the case. I would hope that the vast majority, it's correct. But if you're having a particular problem, our primary care team, we can connect you with a member of our team within the CCG. We can try and bottom that one out. I hope we haven't got hundreds of them, but.
Thank you so much, Fergus. That was excellent. I know that there will be more questions, and I know that some people need a little bit more clarity around certain aspects of some answers and things.
So why don't I say we'll use the next 10 minutes for sort of any open mic. How do you want to do it? I don't know, but if people want to ask anything that they don't think we've covered here, I have sent a message while we were talking to say I'm still held up in this meeting because actually this is important. I'm here. I don't want to skip out the room as it might feel to you to my next thing, but if I could maybe take another 10 minutes, would that be okay?
That would be lovely. I mean, it might help to just hear from a couple of people. I know we've had Monica and things who've had the vaccine. So I know, Fergus, you said you've had it, you'd encourage loved ones, but actually for people in the room who've had the vaccine, and how was it, just so that I know we'll address a couple of things on a safety perspective. Monica, I know you and Mark yesterday, you're not actually showing on my screen, but how did it end up yesterday? You actually had a home visit. You requested a home visit, and they agreed. So what happened for you? Can't actually see where Monica is on my screen.
So hi everyone.
There you are.
Our experience was that we got a call from the GP practice to see whether Mark could go to a centre or would it be best to have it at home. We chose to have it at home, and then Tuesday they called us to say they could come around that day. So that was very fortunate. Mark chose to have the vaccine. Because he's at home, he had the Oxford one because it's easier to transfer to travel with, which is ironically was the one he wanted. I don't, like you say, this Pfizer one has had more negative press, but either way, that's the one he had. He's had very minimal symptoms. He's had a bit of a sore arm, but it's not worse than his normal flu jab. For those of you that might be worried about what the symptoms may be. So no, we have found the GP practice very helpful. They were acknowledging that Mark might have difficulty accessing the centres that have been provided, because he wouldn't be able to go alone, so we weren't sure how we would be received if we arrived in a mass of people just surrounding him. So that was our experience. Kimberly, you're on mute.
Thanks, Monica. Brian popped his hand up. Have you had the vaccine, Brian? You were going to say what your experience was like?
I've had both, in fact, by luck, because I was called up very early from hospital, St George's Hospital, and just fitted in both vaccines. And as far as the reaction goes, there was a mild sort of feel for the first day, and as Fergus said, just no different from a flu jab. And here I am rushing around. So yeah, fine.
Great. And my parents both had the vaccine. So my mum, 72, perfectly mobile and going around, had it because of work, and her arm hurt for a few days. My dad, 83 and underlying health conditions, but mobile, was nervous about having it because he was worried about side effects. So actually that was something, I don't know where he got that from, but he did go and have it and it was fine. His arm hurt for a few days afterwards. That was something that he said, but otherwise both fine. Do we have any burning questions? I know
Kimberly, Anne's got her hand up. Kimberly.
Oh, so Anne, you can unmute. Not everybody's, I've got to go across two screens to see one.
Can you hear
Yes,
me?
we can. Yes, thanks, Anne. Hi.
I have huge apologies for being so late. I never got the code. All I want to ask is, could you tell me, please, having submitted the names of PAs that would like the vaccine, what's the likelihood of them getting it in the near future? Incidentally, I had Pfizer and I've had both my injections. You've now worried me considerably, but anyway, nevertheless, I shan't worry too much. But could you give me an idea, an indication?
Melvin might be able to answer that. Melvin, are you still in these sessions? I can't see everybody, there's so many. Do you want to say what the timelines are? Melvin from the council.
Hi.
Hi, Melvin.
Yes, we're working with KCIL to gather that information on PAs. You should have received emails and texts, but we are doing further communications as well. If we can gather all that information by Friday, the council will be submitting that to the NHS, and we have a coordinated approach with that. I can't say how long it will take from that being submitted, but given the experience we've had with other social care staff, and we are considering PAs within the adult social care frontline remit, I believe they've been contacted within 2 weeks. But I don't want to guarantee that because it's not the councils that's actually getting, setting the calls up and arranging that, but we're definitely going to be submitting it on Friday. The other thing to mention as well, we are extending that, and we're going to be doing that on a weekly basis for those that might want a little bit more time to think about it or have changed their minds, who said they didn't want it and have changed their mind. And there's new PAs coming on board as well. We want to capture everyone. So we will be doing submissions on a weekly basis for new PAs. My guidelines is around about 2 weeks, but it seems to be working quick in Kingston.
Thanks, Melvin. Anne, it's really nice to see you, and I saw you on the telly as well this week as well. I think you're
yes,
our little media star, aren't you?
BBC iPlayer.
I think
hidden disabilities in Britain.
Yeah. Get it on iPlayer still, I think.
So the other bit of sort of good news, if you like, which I hadn't mentioned previously, is that in the next week or two, we'll be opening up some of these what are called mass vaccination centres, where we will have multiple places that we can inject somebody rather than just one or two, if you see what I mean. So we'll have a bigger scale, and as long as we get the supply through, I think we'll go more quickly. But we're sort of stuck in this tense place where we've got all of the staff who are working very hard to get themselves in a position to do this. Next week, I'll be on my week off doing some vaccinations too. But the government at the same time are trying to work very hard to make sure that we have the supply delivered to us. So as soon as we've got it, we'll get through. I think we've got in Kingston and Richmond, I'm sort of conscious I cover both. I think we'll see increased access as the coming days and weeks come. I think there's somebody called Jen who has been waving in my line of sight, anyhow, who I think I wanted to come in.
We do. So, okay, so Jen and also Ali, can I just check first, just because we were talking about PAs. Ali, does that answer your questions now when PAs are going to be vaccinated?
Yes, can I please ask a follow-up question? Can I ask a follow-up question?
Well, go for it, Anne, as you're unmuted. So the follow-up, which might.
Can we stop you? No.
Very kind of you. Yes, please. Yes, please do. Yes, PAs that have been testing already once or twice a week. Do they still need to go on doing that now?
After the inoculation.
After the inoculation. After the inoculation.
Yes, because it doesn't guarantee that you're not going to catch coronavirus. So I want to be really clear about this as well. And just because you've been inoculated does not mean, because you've been vaccinated does not mean that you cannot contract coronavirus or that you might not spread it if you did have it. might not feel very unwell. And remember, a third of people who actually have coronavirus have no symptoms at all.
Right, yes.
So I think it will be important that we continue with the levels of testing that we have, because you could transmit it to somebody else. We don't have the evidence yet that we understand. Even if you've had the virus before and you've been vaccinated, the likelihood of you becoming very unwell are really, really small. What we don't understand is how you might carry it and transmit it to somebody else. It's still too new for us.
That's really, really helpful. Thank you. Yes, I did not know that. Well, I knew partly, but I hadn't got it confirmed. Thank you.
And make sure you continue wearing your mask, even if you've had your vaccine. You can still transmit if you were carrying it. You won't feel unwell. So wearing your mask, keeping your distance, washing your hands, they remain still very, very important behaviors for everybody. I know how the media are describing it at the moment. It's a bit like this is my holiday pass. I'm able to go wherever and travel around and the like. But it's with the cautions still in place.
Okay, so we're going to have to wind down, because we do just want to very briefly mention a couple of things around the employers and PA's relationship on this. Now, Fergus, you mentioned Jen, been waving their hand.
Jen has been waving furiously there, yeah.
Annie's disappeared off my screen, so Jen, yes.
Hello, I'm Jennifer Carpenter. I'm here with my husband, Fred. I live with a very rare, one of the 7 rarest diseases in the world. It affects all of my organs in my body, and it has blinded me. And I asked the doctor in the first lockdown, I was not contacted to say that I was vulnerable. I attend St. George's, because I've got heart problems, I've got cardiovascular, I've got a lot. So we're a bit confused, because Fred's here with me 24/7. I cannot go out on my own. I can't do anything because I can't see where I'm going. Things at home are very difficult. And I just feel that somebody should be taking note of the situation that we're in, talking about, well, but you wanted to ask your question, Fred?
Yeah.
It was just...
How do we get contacted to start the process of getting the vaccination?
So your a combination of two things are happening at the moment. There's your own GP practice itself, and then the NHS list, if you like. So the NHS are doing some mass mailings, so where they will have, everybody's got an NHS number, and they will do some of those cohorts, either offering you the process by which you book your appointment, or your GP will be in touch. If you've not heard from either, then I think it's worth giving your own general practice a call. Do you mind me asking which one it is, which general practice you're registered with?
It's the Groves Medical, and I have a problem with them.
Okay, so maybe outside of here, I'm going to say Jen, because I don't know both your names, but it's Jen on my screen here. Maybe outside of here, either through myself or Caroline, if you could get in touch with us. I don't want to do it here on the screen with everybody else. But if there's something we can do to help connect you with your practice, to make sure they understand where you're supposed to be on the list, and make sure that that's accurate, let's try and help you get that one sorted.
Okay, what was the question you wanted to answer?
I've asked it.
Yeah, you've asked it. Okay.
So it'll be communication, either a general mail shot, which the NHS are sending out to some groups, or your own individual practice have been contacting patients too.
Can I just mention, on Monday at 3 o'clock, I run my iPhone by voiceover because I can't see the screen, and a text came through saying something about the vaccine, and Fred, of course, had to take over, and you either went cancel or accept, and he did accept. They said someone will ring you within 24 hours. This is now Thursday lunchtime, nothing. And of course, I've been waiting since Monday thinking, oh, every time the phone rings, it's going to be the vaccine, but nothing. So, I don't know what to do about that.
I think the most straightforward thing, and I don't mean this to be glib if you've had problems with your practice before, but the most straightforward thing is for us to try and connect you with your practice and your practice manager to get that resolved. But I'm sure that we can, Jen. I'm sure we can get that sorted.
We can, because my disability and my situation is totally ignored by them.
Thank you, Jen and Fred. So Jen and Fred, if you message us and we'll get your details and liaise with Fergus on that. Everyone else, so if you haven't had a question answered, as Fergus and Caroline said, they were happy to come back at some stage, but I'd suggest that you email us. You should all have Jo's email. Give us a wave, Jo, as she sent out all the links for everything, but you can use our inquiries inbox. If not, they'll all come through. So we'll collect all questions that people either perhaps we touched on it, but you need to understand a bit more. Perhaps you've got a question that wasn't addressed at all. So just email them into us and we will either set up another session or send out a group thing. Fergus, yes.
I think Caroline's going to maybe add on a little piece as well. And so I'm going to go. I want to say thank you for the time that you've given today. I'm really pleased to see the ambition and the eagerness to get vaccinated. I personally think it's the right thing to do, but what you must do is get good information. Within that, what I'm going to say is you need to make sure that you're going to trusted information sources. WhatsApp groups, Facebook groups, and the like are fantastic for all sorts of things, but this is an important health program. So NHS websites, the government websites, Caroline, I know, has shared, I think previously, a sort of a frequently asked questions things. Much of what I've talked about here today, in fact, practically everything I've talked about today is information that's in the public domain. What I will say is speak to your GP, speak to your practice nurse, speak to a registered health professional who you know and trust, and make sure you get your advice and your guidance from an appropriate source. I too was hesitant and nervous. If you had asked me in November and December, I would have been a little bit undecided as to whether I was going to have the vaccine or not. I'm absolutely clear about that now, because as time has gone on, the information and the evidence and the advice has strengthened because we've got further into this. It's a very live situation that we're all trying to deal with at the moment. So get your information from a trusted source. That's probably my last thing that I want to say to you. Other than to say, I wish you well, keep safe, stay at home, wear your masks and get vaccinated.